Hello everyone and welcome to today's session. In this video, we will be discussing the MRI consent form, a critical part of the imaging process that ensures informed consent is obtained before performing an MRI scan. As future healthcare professionals, it's essential that you understand not just clinical aspects of MRI but also the ethical and legal responsibilities involved in the patient care. So let's go through the main component of the MRI consent form and what you as a radiographer or nurse need to communicate to the patient. First one is the purpose of the MRI scan. Start by clearly explaining to the patient why the MRI is being done. For example, to assess his soft tissue, brain, joint or internal organ in detail. Second one is nature of the procedure. Inform them that MRI uses strong magnetic field and radio waves, not ionizing radiation like X-rays or CT scan. Emphasize that it is non-invasive and painless procedure. Then screening for safety risks. This is one of the most important part. The patient must be screened for any metallic implant, pacemaker, aneurysm clips, or other devices that could pose risk. Some patients may have metal fragments in their body from previous injuries or surgeries, and these must be identified before scanning. Then use of contrast agent. If the MRI requires contrast, typically gadolinium based, the consent form must be explained why it is needed, how it's administered, and possible side effects of the contrast material. Students should remember, although gadolinium is generally safe, it can cause allergic reaction or complications in the patient with kidney disease, so this must be disclosed. If we talk about the risk and discomforts, while MRI is generally safe, patients might feel discomfort due to loud noises, tight space, or duration of the procedure. Claustrophobic patients may need extra support. Then, rights of the patient. The consent form should state that the patient has a right to ask questions before doing the scan. The patient can refuse the scan or withdraw consent at any time before the procedure. Then the confidentiality and data use in some forms, especially in teaching hospitals or research settings, the consent may mention the use of anonymized images for training or research. As a student, you must understand that obtaining consent is not just a formality. It's about the building trust, ensuring patient autonomy, and practicing safe medicine. Always approach consent with respect, empathy, and clarity. That's it for this overview. In the next video, we will discuss the next topic. So, thanks for watching and keep learning. Kindly like, share, and subscribe my channel.